Moving and transferring the patient. Definition of transferring. Transferring refers to moving a patient from bed to a chair or to a stretcher or to a wheelchair with maximum comfort and safety for patient and nurse. Reason for moving. Change position, repositioning the client. Clients lead down in bed from Fowler's position. Changing the bed linen. Methods of transferring by wheelchair, stretcher, and by a movable bed. Actions applicable before moving a client. The client physical abilities, ability to understand instruction, degree of comfort or discomfort when moving, client's weight, presence of orthostatic hypotension, your own strength and ability to move the client. If indicated, use pain relief modalities or medication prior to moving the client. Prepare supportive equipment, obtain required assistance, explain the procedure to the client and listen to any suggestion by the client. Wash hands, raise the height of the bed to bring the client close to you, center of gravity. Lock the wheels on the bed and raise the rail on the side of the bed. Opposite you to ensure client safety. Face in the direction of the movement to prevent spinal twisting. Transferring the patient from bed to stretcher and from the stretcher to the bed is done to patients who can't help themselves and need help. The selection of transfer technique is individualized. The following methods can be used. Draw sheet method. Patient is lifted by three persons. Mechanical devices like ureter lift. Purpose: to transfer supine client from one location to another. Equipment: stretcher, sheet or blanket, sliding board. Lower the head of the bed until it is flat. Raise the bed so that it is slightly higher than the surface of the stretcher. Ensure that the wheels on the bed are locked. Pull the draw sheet out from both sides of the bed. 4 nurses or helpers are required. One stands at the opposite side of the bed. Remaining 3 stands across the stretcher, one supporting the head and shoulders. Second, one supporting the hips and thighs, and the third one supporting the feet and legs. Draw sheet method. Grasp the draw sheet tightly. Coordinate lifting by counting the numbers of 1, 2, 3, and receive the patient in stretcher by pulling the draw sheet and the patient towards the stretcher quickly and gently. The sheet can be removed by turning the patient from side to side. 3 people all standing on the same side. The patient slip their hands palms facing up beneath the patient. First person holds the head and shoulder. Second, the person holds the trunk up to thigh. And the third person holds the legs. Cradle the patient in the arms so that the patient's weight rests against the nurse's chest and the patient's faces nurses. Care must be taken taken so that the patients will not drop down suddenly. The nurses should be bent over and release the weight of the patient gradually and until it rests gently upon the bed or stretcher. Review the medical record and nursing plan of care for conditions that may influence the patient's ability to move or to be positioned. Assess the tubes, four lines, incision, or equipment that may alter the positioning procedure and identify any movement limitation. Consult patient handling algorithm for moving the patient. Perform hand hygiene and put on PPE. Identify the patient. Explain the procedure to the patient. Close curtains around bed and close the door to the room if possible. Adjust the head of the bed to a flat position. Remove all pillows from under the patient. Leave one at the head of the bed. Leaning position at least one nurse on either side of the bed and lower both side rails. Ask the patient to bend his or her legs and put his or her feet flat on the bed to assist with the movement. One nurse should be positioned on each side of the bed. Grasp the friction reducing sheet securely, close to the patient's body. Flex your knees and hips, tighten your abdominal and gluteal muscles, and keep your back straight. On the count of 3, move the patient up in bed, assisting the patient to a comfortable position and readjust the pillows and supports as needed. Return bed surface to normal setting. Turning a client to the lateral side in bed. Purpose. Movement to the lateral position may be necessary when placing a bedpan beneath the client, when changing the client bed linen or when repositioning the client. Procedure. Pull or roll the client toward you to the lateral position. Document all relevant information.